Today, I will be tabling in this House a bill entitled the Health Insurance Amendment Act 2021, which introduces amendments to the standard premium rate and enhanced benefits under the health insurance plan and future care. The Health Insurance Act 1970 forms the cornerstone of our current national health insurance system, and together with the regulations made under the Act, it prescribes the minimal mandated package of health insurance for all. Specifically, the standard health benefit and the mutual reinsurance fund make up the essential components of an insurance package that all employers must provide and all insurers must include in any policy. Mr. Speaker, the SHB premium portion covers select diagnostic imaging out of the hospital, such as mammograms, select medical home care benefits, such as IV infusions, and select services that support home care. The mutual reinsurance fund is a prescribed amount which each insurer pays into the pooled fund. It covers most local hospital-based care, both inpatient and outpatient services, all insured persons' kidney care, which includes transplants, anti-rejection drugs, transplant coordination, and education. In addition, Mr. Speaker, the mutual reinsurance fund may provide funding for programs that support health for those vulnerable individuals that are uninsured or underinsured. The premium for the mandated package comprising of SHB and MRF is referred to as the standard premium rate, or SPR. Mr. Speaker, the SPR is generally calculated on the basis of the standard health benefit claims experience, the head count of insured individuals, projected changes in fees and utilization, and any benefit changes. Mr. Speaker, I will pause here to further explain the role of the SPR. Honorable members will recall the change to the SPR in 2019, which called for $322 million to be transferred to the BHB in the form of a grant from the government and a transfer from the MRF. The SPR also supports the Health Council Chronic Disease Innovation Fund, full treatment for patients with kidney disease, the Enhanced Care Program, and Personal Home Care Program. Additionally, it funds the administrative functions provided by the Health Insurance Department and provides subsidies to HIP and future care. In this last year, Mr. Speaker, the BHB has been particularly challenged in meeting its commitments due to shortfalls with respect to the funding commitment it in turn requires to carry out its mandate. It has had significant additional expenses due to the pandemic, such as PPE and infection control costs, and at the same time, it lost a substantial revenue stream due to the drop in visitors to the island, which previously generated as much as $8 million annually. Mr. Speaker, the COVID-19 pandemic has upended many of the factors which previously informed the SPR. For a start, the number of insured adults in Bermuda has decreased. Mr. Speaker, for an employment-based health insurance scheme, this is critical. Revenue targets for the SPR over the past 2 years were based on a reported 49,027 insured adults. That headcount is now reduced to 46,300 for calculation purposes as of December 2020, but is reported to be a low 46,181 as recently as May 2021. The loss of insured adults due to unemployment or emigration is real. It impacts the revenue which supports the organization programs and insurance funds that I just mentioned. In addition, Mr. Speaker, with respect to utilization, both HIP and future care have experienced increases in sign-up. The COVID-19 pandemic has altered the economy, with businesses contracting and downsizing. In the Ministry of Health, we have seen businesses and individuals terminate their more expensive private health insurance policies and transfer their health care coverage to HIP. And as we all know, Bermuda has an aging population, which naturally causes the burden on future care to increase almost automatically. Mr. Speaker, each insured HIP and future care client premium is subsidized by the MRF. The HIP subsidy currently represents 28% of the premium, and for future care, that subsidy is 47%. As more businesses and residents join the plans, the increased in associated costs and volumes factor into the annual assessment of the SPR, HIP, and future care. In fact, HIP and future care premiums have not increased since September 2015. Mr. Speaker, a most important element of the regular assessment of the SPR and the HIP and Future Care plans is a review of the benefits themselves in the context of our population's health needs. Mr. Speaker, as I've indicated to this House before, pharmaceutical intervention saves money and interrupts the cost and burden of disease progression. For seniors on Future Care, the coverage for prescription drugs comes with a cap of $2,000 a year. However, those residents on HIP must pay for all medications out of pocket. Enhanced prescription drug benefits for HIP and Future Care clients are being proposed with this legislation. Also, in assessing the benefits currently available, Mr. Speaker, we have identified maternity care and maternal health education as a gap in services for uninsured women. To ensure all children have an equal and healthy start to life, all uninsured women must have access to health care and education at this critical point in their life and the life of their unborn and newborn children. Mr. Speaker, Bermuda's current market realities, including our headcount of insured individuals and changes in utilization and benefits, caused the Ministry to propose amendments to the premiums of the SPR, HIP, and Future Care. These amendments are based on a re-estimated downward of the insured headcount to take into account the COVID economic effect, a review of existing benefit coverage, and population health demands. Mr. Speaker, most importantly, the proposed benefits are supportive of enhanced public health and improved equitable access to critical services. Mr. Speaker, the main changes proposed in the bill tabled today, I will outline now. There will be a $45 increase in the standard premium rate, representing a 13.6% increase. This will account for a new reduced insured headcount to ensure that BHB revenue target is met, and it will support continued treatment for kidney disease patients. The trend is an increase in dialysis patients of 10 to 15% per year, and it will provide a new maternity care benefit for uninsured women, which will secure more equitable access regardless of income, insurance, or social status. There will be a $30 increase to the HIP premium, representing a 6.9% increase. This will be accompanied by the introduction of a new prescription drug benefit covering 100% of cost up to $1,000 in a policy year. There will be a $30 increase in the Future Care premiums, representing a 6% increase. This will be accompanied by an increase in the existing prescription drug benefit of $1,000, taking it from $2,000 to $3,000 per year. Mr. Speaker, this government remains committed to providing a system of health care that results in a healthier and more productive community. It must be stated, though, that we are in a period of transition brought on by an unanticipated and unexpected cost of this pandemic. Mr. Speaker, globally, the pandemic has shown a bright light on healthcare and all in its many strengths, but it has also highlighted the weaknesses. It has highlighted that access to affordable, high-quality healthcare is a basic human right, and one that this government is committed to seeing introduced for everyone. Mr. Speaker, our work on universal health coverage will set a new path for strengthening our health system. This work is ongoing, and we anticipate that before the end of the year, we will be setting out the steps we have agreed with stakeholders from across the system to start this journey afresh. The pandemic has provided us with a new opportunity to work shoulder to shoulder. We must now continue this positive collaboration and develop a health system that we can all be proud of. Thank you, Mr. Speaker.